Hello. Hi, everyone. I think we're starting to get people to come in. We will give everyone a couple minutes to join, but welcome in the meantime. Getting a few more people trickling in. I'll give everyone just 1 or 2 more minutes, and then we will get started. Why don't we jump in? Thank you, everyone, for joining us today. Welcome. I am joined today by, so my name is Liz Swanton. I'll start with that. I'm the co-founder and COO of Qured. Qured is a preventative healthcare platform. We work with businesses to help them reduce their sickness absence, but really by helping people stay healthy. Primarily, we do health screening with clinical wraparound care. And this is a topic very close to our hearts because we obviously we work very closely with the NHS, but we know that also people are getting sicker. There is increased cost burden on employers. And so we're really eager today to talk about sort of why the lines are starting to blur between the NHS healthcare and health at work, and why we're seeing that a lot of employers are stepping up and doing more. And so to talk about that today, I'll be facilitating an open discussion. Please put questions in the webinar chat. What we'll do is present a couple slides with a little bit of stats, and then go into more of an open discussion. So for that today, I am joined by Kish and Grace. Do you guys want to introduce yourselves?
Yeah, thank you, Liz. Yeah, my name is Kishan Vithlani. I'm a Qured's medical director and also NHS GP, and I'm really excited to talk to you guys about the sort of relationship between NHS employers and how we can hopefully better people's lives and health.
Oh, hi everyone, I'm Grace Gimson, co-founder and CEO at Holly Health. So I work in a company that supports people with the process of changing habits and behaviours with a digital coaching tool, which I'll introduce in a moment. But yeah, looking forward to talking about the challenges that we're all facing in workplaces and what kinds of things can we do about them as well.
Amazing. Well, Grace, why don't I hand over to you to introduce Holly Health?
Perfect, thank you. So Holly Health is built by a team of people that spans psychology and product expertise. And our service provides fully digital but personalised health coaching for mental and physical health changes. And so we support the main areas of day-to-day health, including exercise, relationship with food, sleep and mental well-being. And the digital coaching tailors to each person based on their main health goals, many health conditions, and current habits that they have. And the service is built around the process of building habits. And it's driven by friendly coaching nudges, habit reminders, mindfulness techniques, and outcomes tracking. And we aggregate non-personally identifiable population health insights so that our partners can see and understand the challenges that are being faced. And outcomes include significant improvements to exercise, mood, energy, weight management, blood pressure, and more. We've now supported about 60,000 people or more in both NHS and employee wellbeing settings. And we partner with organisations to help them drive health improvement. And we can work with kind of co-branded and white label service offerings. That's enough on me. So over to Kishan.
There we go. I'm actually happy to do a quick intro to Cured, and then I'll hand back for some stats. So as I mentioned briefly, Qured enables basically health screening for the whole workforce. So we have built a program which is incredibly accessible and affordable because we really want to be able to support employers who want to provide equitable health benefits for their whole population. So it is affordable, it is pain-free, and employees love it. We have an NPS score of 88 across thousands of users. It really is incredibly easy, and that's a really key part of ensuring engagement. We enable proactive detection of risk factors. So we screen everything from major causes of chronic disease to critical cancers to looking at lifestyle factors as well. And this really helps us help individuals understand their risk and their health issues, and also help the business understand at an aggregate anonymous level what their issues are so they can better target interventions. We provide personalized health insights to every individual. So it's very much an individual program. You're getting your own health results and clinical support. And we show that this really sparks behavior change. So 84% of our participants make lifestyle changes and stick with them. And 78% report in noticeable improvements in their physical health after doing the program. We also support employees every step of the way, helping them take ownership of their own health and deliver this quantified health improvement. Across what we screen, what we find is that there is a significant portion of the population has really sort of quite risky underlying health markers, which are undiagnosed. We refer about 4% of people directly back into urgent care. So that could be some people going straight to A&E, which is very rare, but does happen, but also really finding significant conditions which need to be picked up immediately. And we refer back into the NHS most of the time, which is why this is a really important topic for us. And we find the program works. So we improve multiple biomarkers in year 2 and in the overwhelming majority of people. So really sort of proactive intervention is incredibly effective. And so that's what we do at Qured. It's probably enough for me to talk. Grace, shall I hand back to you to talk a little bit about some of the stats that we're seeing? So I guess just to set the scene, we'll talk a little bit about, what are the factors that we're seeing that are actually leading to increased time off work? So what are you seeing on your side?
Yeah, so I've got here a few stats across kind of mental health and lifestyle behaviors in particular. So I just wanted to highlight a few of these because obviously so many of the challenges in the workplace right now are linked to how do we feel each day, how are we able to kind of cope with various challenges that pop up, and a lot of that is down to behaviors. So at the moment, we see that 25% of UK workers report feeling unable to cope with workplace stress. 79% of employees are experiencing moderate to high levels of stress, and it's actually worse for younger employees and women. Signs of burnout are increasingly common, with 63% of UK employees showing symptoms, and that's going up as well. Nearly 10% of UK adults take time off of work for mental health reasons over a 12-month period, and almost half of these absences last longer than a month. People are spending on average 9 hours sitting per day, compared to, if you look back to kind of pre-industrial times, it was estimated to be about 3 hours per day. That really wasn't long ago, and our bodies have not changed. So it's no wonder that we're really challenged with the kind of practice of sitting for so long. And looking at Holly Health data in particular from at least 20,000 people that have used the service, just wanted to pull out some of the key stats that we find quite interesting. So 45% of Holly Health users sleep under 6 hours per night, 55% are tired most days, 47% have high anxiety levels, and only 4% are achieving flexibility exercise guidelines. And we know that the Holly Health data we see is quite reflective of a large portion of people in the population. And so I think this kind of indicates some of the factors affecting us, how are we able to get through our workday consistently over time. But one more statistic I just want to highlight, which is quite a nice one. Companies that foster a culture of open communication and mental health awareness see a 20% increase in employee retention rates. And then one more, those that invest in mental wellbeing programs see an estimated 4.7 times return on investment. So there is an opportunity there. There's also a lot of challenges, and we'll kind of discuss these in more detail on the call.
Yeah, absolutely. Thank you. Kish, do you want to talk a little bit about some of the chronic and physical conditions we're seeing?
Yeah, thank you. So first of all, I'd like to say that actually what Grace mentioned about sort of the changing environment in terms of the impact of mental health, cultural and lifestyle factors is very much mirrored with what we're seeing with chronic conditions. And chronic conditions are reshaping the working population. And there's a lot of evidence and a lot of data to support this. Just to pick out a few, there's a growing proportion of the workforce that's limited by health. In 2023, 7.5 million people aged 16 to 64 reported having a work-limiting health condition, and that's a steep increase from 2016. And actually, if we look to the future, by 2040, major diseases such as cancer, diabetes, kidney disease, they're projected to increase by more than 30%. We're already seeing that trend. So if we look at the chronic disease becoming the norm, not the exception statistic there, in 2021, 40% of adults aged 16 and over reported living with at least one long-standing illness or condition, which is a huge number, almost half of the population. And, everyone is affected, but there are some groups of people that are affected more than others. So we know that people that do night shift work, have high stress jobs, have sedentary jobs, are at higher risk, but also healthcare workers as well. So a research into healthcare workers found that metabolic syndrome prevalence was almost 12%, and it was closely linked to the high stress levels that they reported as well. So we've already mentioned metabolic syndrome a couple of times. So let me just give you a bit of a sort of a background about that and to explain why we focus on it. So metabolic syndrome is one of the most prevalent and preventable health threats impacting today's workforce. It describes the underlying conditions that come together that increases your risk of having a heart attack, stroke, diabetes, but also things like dementia and premature death. So there's a fourfold increase in having a heart attack, fivefold increase in stroke, and a sevenfold increase in diabetes. So these are huge numbers, and has a massive consequence on the person that it affects, but also the workforce on a wider scale as well. And from the data that we've collected from our client populations, we found that actually what we're seeing in terms of the rates of metabolic syndrome, biomarkers and abnormalities exceeds what's sort of estimated for the nation. And so actually, we know that metabolic syndrome affects 1 in 4 people, both in the UK and globally, but that's probably an underestimation as well. And what we found from our data, that the impact on shift workers is also supported with strong research evidence as well. So male permanent night workers show a significantly higher rate of metabolic syndrome compared to day workers. And there's huge cost implications to this as well. Metabolic syndrome causes higher healthcare and pharmacy costs, more short-term disability leave, greater productivity losses. And I'd like to mention a little bit about obesity here as well. So obesity is one of the factors that contribute to metabolic syndrome. It's not metabolic syndrome isn't just a condition of the obese. Actually, slim people and people who are a normal weight are also equally at risk, but obesity does increase the risk of the end organ damage, so heart attack, strokes and things like that. And obesity related productivity losses exceed weight loss intervention costs. And so there should be a real focus on trying to prevent obesity, prevent metabolic syndrome, rather than accept it and take the consequences of it.
Wonderful. Thank you. So that's all the slides that we have. And I want to sort of go from having a bit of a presentation to a little more of a discussion. So please, anyone who is listening, throw in questions, as I've said, as we go. But I guess my first question is, obviously the data is telling us that people are getting sicker. And, whether it's mental or physical health, there is an increasing burden of disease. What does the data tell beyond that? What are the implications here that you're seeing, and what are some of the things that you think are driving that?
So maybe I'll kick off on this one. So we're seeing a pattern where relatively silent conditions, so things like poor metabolic health, mild depression, undiagnosed diabetes or pre-diabetes, because they're silent conditions, they often go missed, or they go unaddressed, and people put it down to, oh, it's burnout, oh, I'm tired, oh, it's lack of sleep, oh, it's stress. And that results in a lack of timely intervention. And that results in things escalating and chronic disease rising, and sort of when it's identified, sometimes it's often too late. And so there's a real reason to actually identify these problems much, much earlier than what we're doing right now to prevent the end organ damage. By that I mean heart attack, stroke, diabetes, because once you get to that stage, to sort of rehabilitate yourself back to a normal state is so much harder and so much more difficult, and to get to your same productivity level is so much harder as well. And also, people's working lives are changing as well. We've got more shift work, we've got more high stress roles, we've got more sedentary work, as Grace mentioned before, and that's definitely contributing. We are seeing some positive changes. Smoking related illnesses are on the decline, but obesity related illnesses are rapidly increasing and almost exceeding as a factor of causing serious health problems, but also things like cancer as well.
Yeah, the fact that these conditions are kind of going under the radar because they're not causing severe illness straight away. People are able to function and get on with their lives for a very long time before it gets more severe. This links to how much funding and priority is going in the NHS on prevention. It's less than 4% of the NHS budget. And so when the starting point is that our national health system is not focused there and not investing there, and then if you want to dig into kind of specific pathways and areas of support, we now have about 21% of the UK population is on some sort of an NHS waitlist to get access to any support. And that doesn't just affect the employees, it affects family members. So people that you might be caring for. The millennial population might be looking after kind of aging parents as well as children. And you've got that compounding factor. And on the mental health side, which is actually the biggest reason now for long-term sickness in the UK, if you look at the talking therapies access across the UK, the published figures from the NHS do show a slight improvement in the waiting times on average, but it's very, very different depending on where you're located. So I was just doing some digging earlier, and I found that just from a quick look, the West London region, for example, sets the expectation that you should be waiting 2 to 5 months just for your initial appointment for talking therapies. So it's very variable. A lot of people are not able to get that type of access. And so their employers are feeling more of the strain from all of these.
Amazing. That's super helpful. I guess maybe that's a good transition into, I've certainly got more comments on sort of the things that are going wrong, the lifestyle factors, but actually, maybe let's talk about the NHS a little bit. So I get, wait times are increasing. We know that. There's very low investment in prevention. But why do we think the NHS can't solve this problem? And why should employers? So why are we talking about employers today, right? So what's happening there? And maybe talk a little bit about the dynamics that you see.
I can
So, go on, Grace, I'll let you go first.
Thanks, Kishan. Just a quick note on how does it actually affect employers? I think that there's 3 main ways to call out, and that would be sickness, which is really obvious. So people who are absent from work, and that's probably the area that most of us instinctively focus on, who's not here and who's kind of on long-term sick. You've got the presenteeism challenge, which is people who are attending work and they're not off sick, but their productivity might be much, much lower for various different reasons. They're maybe not as engaged with what they're working on. That is actually the most significant cost when it comes to these types of challenges. So a Deloitte report estimated that absenteeism, so sickness, costs about 7 billion per year, presenteeism about 24 billion a year. And then staff turnover, so people leaving because they can't keep up with it anymore or they want to go somewhere else, about 20 billion per year. So sickness is actually the lower cost of the 3. And I think that's just helpful to bear in mind when we're thinking about what's the real problem here. Is it that people are not able to attend work because they're too unwell? Or is it also because they just don't have the energy and motivation to kind of deliver what their employers are seeking as well?
Absolutely. Yeah, no, that's a very good point. I think, when we at Qured, we also very much see the costs in terms of increased insurance costs, early retirement, skills loss, all the same things that you see that are quite, I guess, some are easier and some are harder to measure. But absolutely seeing those increased costs. Thanks, Grace.
So maybe I should just mention a little bit more about the NHS. So as an NHS GP, you know, I have to vouch for the NHS and say the NHS is doing its best with limited resources. But early stage support for people at risk of long-term absence simply isn't there. You know, I think most of us has probably experienced, myself included, getting access to an appointment, whether it's your initial appointment to your GP or then being referred to a specialist. It's challenging and it's time consuming, and you have to wait a long time to actually be seen by a specialist as well. And you know, there's a lack of resources, there's a lack of funding. You know, everyone's working very hard. Going back to what you said, Grace, about presenteeism, we see that a lot in the NHS, people feel very guilty about taking time off work because the impact it'll have on your colleagues, what it'll have on your patients. And so we see that in the NHS as well. And you know, there is a huge guilt factor there. There is a huge factor of, you know, letting down my patients, but it doesn't help the productivity and the efficiency of the service as well. And that's a big problem. You know, in December 2024, there was almost 7.5 million procedures and appointments that were pending. So, you know, we're talking big numbers over here and long wait times. And I see that the challenges of the NHS sort of trickle down into primary care. So when I refer somebody for a cancer diagnosis or a suspected cancer diagnosis, actually that patient should be seen within 2 weeks, assessed and diagnosed, and have an appointment. And we're seeing that target being missed more and more, which shows that if the most crucial part of the service is missing its target, then there's probably much bigger problems higher up in the referral pathways.
Yeah, absolutely.
And one more thing just to add on the challenges faced by the NHS, or two actually. One, probably a lot of people on this call have heard the shake-up that's happening at the moment. So we're going to lose NHS England as a body, and the roles within it might shift to other places, but a lot of them will be gone. And then integrated care systems, which oversee the regional delivery of care, are going to go through a 50% cut. That's probably going to involve 50% cut to employees as well as spending. So I think a big challenge that we're going to have. Maybe there will be improvements in kind of output over the longer term, but shorter term, we can expect not many new kind of levels of commissioning that are going to be impactful. It's going to be a big shake up for a year. A lot of people are not going to know if they've got roles or not. And so I don't think we can expect significant improvements to what we're seeing in the NHS within this year anyway. So yeah, more and more kind of reason for employers and leaders at work to consider what can they possibly do to help their employees to sustain themselves through the challenges.
Yeah, absolutely. No, absolutely. And I guess, you know, certainly you understand why, you know, when someone is very sick in front of you, you have to deal with that first. And you understand why prevention ends up being on the back burner a little bit when you think about being incredibly stretched in the NHS. One of the interesting things we also certainly hear is we hear anecdotally from our users that people are concerned about overburdening the NHS. And so they don't seek care proactively enough. So they don't go early enough because they're worried. They're saying, oh, well, you know, I'm okay, it's a niggle, whatever it is. They don't seek care, and then they end up much sicker when they actually arrive. That transition us very well to, I think, sort of some of our next topics, and also a question from the audience. So asking, how are we seeing engagement from organizations to support staff around this? And what do we think, what factors are impacting levels of engagement? So I guess looking at that from, you know, organizations, what are they actually doing? What can be done? And, you know, are we seeing staff engagement?
Yeah, I dug in some quite interesting research around this. So a survey from MetLife that was carried out in the last year, they were trying to review what do the employees find most important at their workplace to kind of keep them motivated, especially mentally. And this links to the whole presenteeism and being able to just kind of consistently keep delivering. So they found that top of the list in terms of most important thing was work-life balance. So 94% of people finding that really important. Second was ability to pursue interests and passions outside of work. That's quite an interesting one as well. So I suppose linked to flexibility, employers kind of enabling people to follow their passions alongside the work. Third was having a meaningful or purposeful job. So 84% of people find that important. And I think that's one that employers can actually act on quite well in loads of different ways, which we could talk more about. Next, we've got benefits in addition to salary. So what else is on offer on top of your pay package? Corporate policies aligning with personal values is another one. And I think here, corporate policies are not always known or kind of readily discussed with employees, and that might be an opportunity to help people to align their values in a more obvious way. And then the next one, which I would have expected to be higher up, was career growth and development as being important. That was important to 69% of people. So yeah, I think that gives some insight into what people are looking for. Basically, an ability to live their life while they're going to work and not for everything to be about the job that they're delivering.
Absolutely, absolutely. I think that's incredibly interesting, certainly. What else do you think what can be done to get ahead of this problem? So in what ways are employers able to prevent people going off sick in the first place? We've agreed they have a role to play, and it's about creating an overall inclusive and productive workplace in addition to sort of band-aid fixes. But what are some of the ways that, and when we were chatting earlier, we talked about sort of joined up care. What are some of the ways in which companies and employers can help people holistically?
So I think there's a lot that can be done actually, and we can probably have a huge discussion about this and go through all the little things. But I think first of all there needs to be a cultural change. I think there needs to be a health enabling culture. We need to normalize conversations about health, mental health, hormonal health, fatigue. We're to encourage and promote people taking preventative behaviors, making good lifestyle changes, not encouraging people to come into work when they're burnt out and when they're stressed and when you can see somebody struggling. And that involves some training as well, picking up the early signs of burnout, disengagement, distress, that sort of stuff. So that I think the culture is a big part of it as well, but also supporting the workforce with early detection through screening. As I said before, a lot of these things are silent. They have no symptoms, or symptoms are very vague. And until you test somebody or offer them a test, things won't be identified. And these are significant things and have a huge consequence on not only the individual, the business, the family. Things like heart attacks and strokes, they can be life-changing and debilitating and can really affect everyone involved. So really, really important to look at early detection through screening. And not only just look at what's abnormal, what's not, what's normal, but also look at the risk scores. How do we risk stratify your population? How do we say that 10 or 15% will likely to have a heart attack or a stroke in the next 5 or 10 years? And so that's a really important thing. Personalizing things, having a health advisor to actually talk through what the results mean, what the test means, how to holistically approach behavioral change. That's a really important thing, because we've realized that actually mental and physical health is very, very closely related. And you can't just give somebody a result and expect them to change, but you've got to look at what are the barriers to them making that lifestyle change. What's their home situation like? What's their sleep situation like? What's their job like? So you can really tailor the care and the support somebody needs to get there and make that change and really turn things around in their life. And again, approaching things holistically involves looking at the root cause. So people have mental health problems and musculoskeletal problems at the same time as other chronic health conditions. You've got to look at everything together to try and actually get to the bottom of the problems and address the underlying problem. So I think there's a lot that can be done, and it's needless to say that doing this actually bridges that gap between the NHS and real life. We know that the NHS isn't quite hitting the mark and offering the services that it needs to do. But as an employer, if you can fill that gap, then you can really boost somebody's health and prevent any serious health conditions.
Yeah. And just to expand on that, I think the kind of cultural element is so key, but I think it's also like, okay, how do you just create a culture? And I think there's some really key things that can work really well. So one of them, for example, like Kishan mentioned, is having a routine process where you have an annual screening, for example. Similarly, you could have an annual review that actually looks at what's the picture of health in a maybe a less kind of health check type of way, more of a well-being check, which can be done digitally or it can be done through surveys. And if you understand regularly what's the picture and the challenges across mental and physical health and review those in a with leadership, then you can start to make plans for what you can try and improve and measure those changes. But ultimately, just the kind of screening on its own, even if leadership look at it, it's not really going to do enough unless if there's a culture that's kind of communicated and happening at all levels. So each different kind of team member should start to become, or at least team leader should start to become more responsible for communicating about well-being with their team, maybe talking within their team about what are small achievable processes that they can enact to protect well-being. It might be that they do really small things like they aim to not communicate all the time outside of working hours. You can use all these different scheduling approaches through email and help to kind of protect working hours. You can obviously lead by example by not burning yourself out and checking in on your team members as often as possible, and helping people to connect with their purpose more. So rather than just focusing on kind of what's your work and delivery and KPIs, also what's the bigger picture of like, why is someone here? Do they actually feel that their work is meaningful? And maybe there's a way to make it feel more meaningful through a kind of direct manager-employee relationship. Flexible working is obviously going to be extremely helpful for a lot of people, as we saw from some of those survey results. And just making sure that people understand and relate to the company missions and values, like simple exercises to look across the company and work out why do people work there and really emphasize that across departments. And I think one other thing that I've seen work very well is in promoting and encouraging people to connect with each other, not just on work things. So obviously we saw one of the survey responses saying that people want to be able to pursue their passions outside of work. So how about letting people kind of bring those passions to work as well? So simple things, lunch and learns about what someone has done over the weekend or what their sport passion is. And people can form a more kind of human connection outside of what they're just working on.
Yeah, I think that's all incredibly valuable and incredibly relevant for sure. I think that one of the things that we also really hear, and this will lead, I'm going to take a few questions that there's some interrelated questions on the Q&A that I'll take and put out to you guys as well. But one of the things that we look at is sort of the point on an inclusive workplace and inclusive health benefits. And a lot of health checks, and this is something that, we push really hard for, is the accessibility and equity in access. So health benefits traditionally have been provided mostly to the highest paid portion of the population in the workforce. You see a lot more private medical insurance, health checks, that sort of thing provided to white collar workers, people working in an office, people higher paid. And shift workers have typically been left behind, people who work nights, people who are more distributed or remote or work on site. And I think to your point about making people feel valued in the organization, and bringing them a sort of that a piece of the sense of shared purpose and feeling like you're truly part of the team is equitable access, I think is an incredibly important point. And that's something that we see in a lot of our clients. And there's a few different interrelated questions here. And I'll see if I get any of them wrong, then please clarify the people who've asked them. But one question is how to use PHM. I'm assuming that's population health management tools as part of the Qured platform. There's another question around saying social determinants play a crucial part in terms of impacting health. So is there a concerted effort to harness and utilize the social determinants of health to drive meaningful health intervention and behavior change? Is the health system effectively integrating SDOH insights into care delivery? And then one about how can workplace health initiatives better support underrepresented groups, such as those from lower socioeconomic backgrounds or insecure employment? So I think there's a theme here around the fact that obviously we're talking about the NHS and we're talking about work, but people live in the world they live in. Come from different socioeconomic backgrounds. We know that people who are typically from lower socioeconomic backgrounds are left behind and have worse health outcomes. So, what are some of the ways in which Qured or Holly Health are addressing that? And also, what do you see overall? What are your thoughts and recommendations about how to do that? Obviously, with interplay between we're talking mostly about people in work here, right? And what employers can do to stop them dropping out of work. But yeah, curious to hear wherever your thoughts go on those questions.
I think they're great questions actually, and there is there is evidence about there being social determinants of health and people who are underrepresented and underserved, and I think that's one of the problems that we see with the NHS health check. We have this NHS health check, but what actually the evidence is showing is that it's not driving that change and reducing significant chronic diseases because there's a poor uptake. It fails to engage those who are at the highest risk, those working doing shift work, deprived communities, ethnic minorities, people with poor health literacy. And these are some of the key reasons why it's not as effective as it should be, amongst other things that it's not as comprehensive enough and problems with access and things like that. But that's why having an employer-based health check is good, because the employer is uniquely placed to have better access to their employees and their workforce. They can engage them better, can interact with them more, have more access to them, and actually get them under their wing and do the testing and do the intervention that's needed. And so that's why having a workplace-based initiative or a workplace-based testing is so much more accessible and so much better at driving change than something based in the community where there's even the challenges about having the time off work to be able to engage, for example, or your shift pattern not allowing you to make appointments and things like that. So I think just the nature of it being a workplace-based initiative makes it so much more accessible to everyone, regardless of where they are in the community or in the social determinants of health.
Yeah. I know Cure's doing some awesome work on actually putting the health checks in like an obvious place in front of someone, like go to their workplace and it's there if you want to use it. And that's so much more effective than sending one text message from a GP in some cases where people might not actually be receptive to a text message from their GP. So yeah, massive opportunity there. And I can also see part of Rima's question is the health system integrating these insights into care delivery. There's actually some really interesting work going on with the WorkWell schemes, which you may or may not have heard of. It is mainly focused on people with long-term conditions, but this is also naturally going out to a lot of people with different factors affecting why have they become ill in the first place. It will be focused on more kind of deprived communities as well. And this is a government scheme which basically takes NHS funding and resources and then is connecting with lots of different employers and workplaces to get people more support to either keep well and keep working or to get back into work if they're off sick. And so it's just quite an interesting process where we will see more of this happening. The NHS work will start to shift kind of outwards towards employers because they know there's an opportunity to do more there. So I think if you have a team, if you work in a company that's trying to improve health, kind of keeping an eye on where the government's going and seeing, can you actually be involved with some of those programs? Maybe you can piggyback and actually benefit your employees as well. So yeah, but it's a huge challenge, and there's going to need to be kind of targeted support as well for lots of different groups to make sure they get what they need.
Absolutely. we're about 5 minutes from the end, so I want to put out to sort of ask the audience if you're facing any major challenges now, what are the things that you're thinking about now, that you see as your biggest challenge? And in the meantime, I'm going to take one more question here, which actually I think talks about, which is a very, very good question as we're talking about both the, I guess, struggles of the NHS and then also how we're seeing more of sort of potentially that NHS funding moving into the communities and uh, moving into employers and to have them help deliver some of these health services or engage people. But is still a potential very big challenge. So the question is, if we pick up something, so what should employers do if potential health condition has been picked up via health check? So if you're still facing a very long wait time, well, they're referred to primary care, but they have long wait times to get an appointment. What can be done in that situation? And I guess, you know, I might throw this one to Kish because I think this is certainly health check related, but say as cured, I think one of the things we think about, we want to work more closely with the NHS. I think that, and I think a lot of employers would potentially want a closer relationship or be able to maybe use third parties to facilitate that interaction and ensure that there is a more, as we see more of the health services potentially move from the NHS to being provided via employers and private, how do we ensure there's better interconnectivity there?
So, yeah, we'd love to be able to integrate more closely with the NHS, and that is definitely the future, and definitely on the agenda. But right now, what we do is that if we see, well, first of all, you have full access to your results. So you as an individual will have everything up there in your fingertips and on your hands, your blood biomarkers, what they mean, what needs to be done, any referrals you might need. So you'll have full control. That's the first thing. But what we do secondly is that if there's anything that needs follow-up, then we arrange a follow-up ourselves rather than referring you back into the NHS, just so we can monitor you and actually see whether you're improving or getting worse or not. And when you do get to a stage where you need to be seen or need any further treatment or referral or anything like that, we organize that for you. So we write to your GP and let them know what needs to be done, preventing the need for you to even actually book an appointment with your GP to go and see them because everything is written and provided to them. And if they need to do a referral based on those grounds, that can be action, reducing and minimizing any delay that needs to that would happen. Sometimes if we think that you need to see a specialist as well, we'll also do that specialist referral paperwork as well, which because of the current system does have to go through your GP surgery, but again, it reduces a lot of the delays. And there's we can talk to you about how to get better access to some of the secondary care services. Sometimes when you refer to the most local hospital, that probably isn't the quickest, but if you're willing to travel a few miles down the road, that would give you access to much quicker quicker services. And because every hospital's at a different waiting list and different time, and there are certain nuances around this, and we can personalize that for you to be able to make sure that you get the quickest possible care and service.
Great.
Yeah. And if someone is being referred for a kind of lifestyle related condition, there is other support that could be available to them in the short term. Same for mental health. So obviously, if they're waiting for a chronic condition referral through the NHS, then chances are their doctor, when they end up seeing them, will actually advise various lifestyle changes anyway. So if there are programs or support opportunities that you can get them access to help with the lifestyle factors and the mental health factors, that's an opportunity as well. There are solutions out there, including Holly Health, which help with each individual and kind of setting up the right habits for them. And we have been working in some contexts with waitlists, so people who are kind of waiting for some kind of help, but how do we stop them declining in the meantime? So there is a big opportunity there.
Absolutely, absolutely. I mean, we know that there are waiting lists, and we just have to figure out the ways to help people, in the best that we can. And again, take some of the burden off the NHS, so those waiting lists can start to drop. I guess we're just about done on time. Is there anything else that you want to mention? Any closing remarks? Anything else that you think would be helpful? And maybe a final closing remark on sort of what do you think makes a successful I guess a successful workplace program? What is something that you think employers can do? And what would be a highlight of that?
Yeah, I think just to give a final note. So obviously we know that things aren't improving in general. Things are actually getting worse in quite a lot of areas, especially on the mental health side and musculoskeletal side, for example, and chronic conditions. But we know that the employees want to feel a better sense of purpose. They want to feel engaged with their life and their work. And there are lots of small practical ways to do that which don't cost money. So I think I would basically challenge everyone to go away and think about what's one kind of small cultural thing that can be implemented in the workplace that helps people to feel more connected with what they're doing and maybe the bigger picture. Because we know that can then impact their energy levels around it and their mental health and other elements. Yeah, so I would just suggest that as one thing to go away and think about.
I think what I'd say is actually, if you are going to offer a health intervention, it needs to be relevant, accessible, engaging, but crucially not rushed, so a holistic approach can be taken to drive behavioral change. And it's really important to have these sort of values in that, because there's a very close relationship between mental health, such as mood, sleep, stress, and physical health, such as metabolic syndrome. And addressing both is really required to prevent any economic activity and better long-term health. So, there are certain specific values that need to be incorporated, the kind of values that we offer at Qured, to help, promote better long-term health.
Amazing. Well, thank you both very much. Thank you to everyone who joined. We will send around the recording and make it accessible for people who couldn't join today as well. I hope that you found it useful and interesting. I certainly did, and could talk about it all for a lot longer, but at least we've covered some topics that I hope were interesting. And thank you everyone who engaged and asked questions. And we'll leave it there.
Thanks, everyone.
Thank you.
Thank you. Bye.